All right. I think while I see that still, participants are joining, I do think we have a lot of people already kind of online, and we should use the time we have to the maximum. So delighted to welcome you all to this online event on health promotion and disease prevention, lessons learned from cooperation in the HIV/AIDS pandemic. My name is Christoph Benn. I have the pleasure to be your moderator today. I'm serving as the Director for Global Health Diplomacy at the Lange Institute based in Amsterdam and Geneva, and really looking forward to this very interesting topic and the discussion we are going to have. I see from the names of those of you who are joining that many of you would have been excellent panelists as well. We really have a very distinguished group today, and I hope really that you will be able to contribute later on in our discussion, and we'll try to make sure that there will be time for that. So with these housekeeping remarks, let me really formally welcome you also on behalf of the German Federal Ministry of Health and the Global Health Hub Germany as the hosts of this session. Many of you are probably aware that the Global Health Hub Germany is a network that aims to bring together all actors interested in global health in Germany, with by now more than 1,300 individuals and many organizations that have registered in this hub. And it is really my privilege to be able to moderate this session for you. This session today is also meant to be a kickoff session for an online event series will be organized by the Ministry of Health and Global Health Hub Germany called Shaping Health Globally, from the German Health Strategy to Shared Commitment. And it is in the context of the strategy that the German government has approved and adopted in October 2020, and that is now being implemented. And I know from my own experience in that process that the creation of the Global Health Hub Germany was really also part of this whole process of developing the strategy and strengthening, the collaboration around global health in Germany. And one of the priorities of this strategy is promoting good health, preventing diseases, and developing adequate responses. So that's why the topic we are discussing today is so timely. And I would really like to congratulate the Health Hub and the German Ministry of Health for putting this important topic on the agenda. Because these days, with the overwhelming focus on COVID-19, it is easily forgotten that the first major pandemic after World War II has been HIV, and it is far from over. AIDS has killed more than 32 million people after its first description in 1981, which is exactly 40 years ago. And I think it is sometimes important to also remind ourselves of the differences between HIV and COVID and the response to it. And as I was preparing for the session, I thought myself, as I was pretty much engaged from the beginning on HIV, that in 1981, after this disease was first described, it took 2 years to identify the virus. And you will remember that it took only a few weeks last year to kind of have the genome sequence of the SARS-CoV-2 virus. What a difference. It took 4 years at that time to develop the first reliable tests. And also already in January last year, we had the first tests that could be applied. Amazing, I think, if you think back of that. And for HIV, as we all know, we don't have a vaccine until today. It has been a kind of big fight and lots of investments and so on. And still, we are waiting for and hoping for a vaccine one day against HIV. And it took a little bit more than 300 days for COVID-19. On the other hand, we have effective treatment against AIDS, but we also know by now that we will not be able to treat ourselves out of the HIV pandemic. And I think this is an important aspect for our discussion today, that we should not forget how important, prevention is, although there is highly effective treatment. And the recent UN political declaration on HIV/AIDS adopted by the General Assembly last month highlighted the importance of HIV prevention. And just a couple of points. Infections are still increasing, HIV infections, in 33 countries. And our special focus, I think, also of the discussion today will be the vulnerable and key affected populations in HIV. And the declaration of the UN reminded us that men who have sex with men have a 26-fold higher, probability of becoming affected than the general population. IV drug users have a 29 times higher probability, and sex workers in many countries a 30 times higher probability of being infected. So I think this should just remind ourselves, why the topic of today is so important. And I really think we have a fantastic panel today that will, provide inputs and help us in the discussion. And let me in particular welcome Ellen Mubanga from the National HIV/AIDS TB Council in Zambia, who will provide us with insights from her work in Zambia. Welcome to Peter Wiessner. Peter has been leading for many years the German network Action Against AIDS, and he's well connected with civil society around the world and many of the international organizations. And big welcome to our two representatives from the ministries that are so important in the German response to this disease, nationally and internationally. So most welcome Binod Mahanty from the Ministry of Health, responsible there for HIV, hepatitis, and other STIs in the section of infectious diseases. And welcome to Alexander Freese from the German Ministry for Economic Cooperation and Development, where he is in the kind of global health section and responsible for representing the German government also on the boards of many international organizations. So I think we have a really very distinguished panel that I'm happy to welcome. And I would first like to hand over to Binod from the Ministry of Health with some introductory remarks. And we are really looking for some insights, Binod, into the role of the German government, the Ministry of Health, both in the national, but also then in the international response, and why HIV prevention is so important in this response. So first of all, over to you.
Yeah, thank you, Christoph, for this kind introduction. Thank you, colleagues, and I'm excited to be part of this discussion, which has, I can see overwhelming interest, which is excellent. So I think what we thought would be important is to bring everyone on the same page. I would just make a brief introduction into what we mean by prevention. When we talk about prevention, what are the different aspects of prevention, and then just briefly touch upon the arrangements in Germany when it comes to this. So these are the elements of combination prevention. When we talk about prevention, we see three colors: blue, red, and green. Blue, and then we see a shaded area. There's prevention methods that fall in both areas, but fundamentally we have biomedical prevention, we have behavioral prevention, and we have structural prevention in green. These are the three distinct areas. And this is important because it also highlights the focus that we have internationally, where, for example, Germany focused a lot on behavioral prevention and others focus more on biomedical factors. So if I can have the next slide, please. Just to bring everyone on the same page, we're talking about combination HIV prevention, which combines behavioral, biomedical, and structural. They're all part of primary prevention, and primary prevention's goal is to reduce the incidence of transmission in people who are not HIV infected. So this is primary prevention. When we look at behavioral interventions, we see what is part of that. It seeks to reduce the risk of HIV transmission by addressing behaviors. And this includes, for example, comprehensive sex education. It includes counseling. It includes programs that reduce stigma and discrimination. So these are behavioral interventions. When we come to biomedical interventions, these are usually a mix of clinical and medical approaches. Treatment as prevention is a big slogan that we've heard. So when we treat people, we can also contribute to a reduction in HIV transmission if the treatment is successful. But there are other measures. For example, PrEP is one other measure, which is the pre-exposure prophylaxis, which you can take to avoid infection. especially among gay men. You have also circumcision, you have needle exchange programs, you have PMTCT, the prevention of mother-to-child transmission. So these would be examples of biomedical interventions. And then we have structural interventions, which are more broader, which you've seen in the green color, which are basically legal, political, economical, social interventions. And they play an important role also for UNAIDS, which is the leading agency in the fight against HIV, which also looks at structural interventions, which they call barriers. If I can have the next slide. Just as an example from Germany, which has also been used in many developing countries, it's the join-in circuit. It's an example of a behavioral prevention. It's part of comprehensive sexuality education. This is implemented in schools, developed by the German BZGA, the Federal Center for Health Education. And it's been, the initial version was launched in the 1990s, but this has been applied in schools, and it can also be applied out of schools. And it's really about condom use, it's about sexual diversity, it's about games, quizzes, and discussions. And this is when we talk about importance of behavioral prevention internationally, this is one example of what we mean by that. And lastly, if I can have the last slide. I just want to bring everyone up to speed with the arrangements in Germany, just as an example. So the actors in the HIV STI response, the Ministry of Health, it complements the public health infrastructure that we have, the federal, states, and districts, which are part of that. The Ministry of Health basically implements, and these are the two columns on the right, and the center, it implements its prevention programs through the Federal Center for Health Education, and they target the general public and young people. And then we also we give funding through non-government organizations, specifically the Deutsche AIDS-Hilfe, where we target specifically key and vulnerable populations, MSM, IDU sex workers, also prisoners and migrants. And just as an example, the measures that you've seen, the Mitmach, the join-in circuit was done by the BZGA. It's part of the awareness campaigns in schools, but they also do posters, and they do a lot of training of medical professionals. Whereas the Deutsche AIDS-Hilfe works specifically with targeted campaigns for vulnerable populations, awareness raising and testing and counseling campaigns. Just as a setup for the arrangements in Germany, it complements the national health infrastructure, which is the structure that also provides the treatment services. With that, I would give back to Christoph. Thank you.
Thanks so much, Binod, for this excellent introduction into the topic. And obviously, we'll come back to you later on with follow-up questions. But I would now like to bring in our other panelists, and first go to you, Ellen. Ellen, you're working for the AIDS Council in Zambia, and I'm sure you have seen that over many, many years, evolving the important work you're doing there. How is it from your perspective, the importance of HIV prevention, but also maybe the challenges you've seen in your work? Could you give us a little bit of insight into the situation in Zambia these days?
Okay, thank you very much for that, and indeed wonderful presentation to give us a highlight of the work in the ministry in Germany. So what are the challenges of HIV prevention here in Zambia? As you are aware that Zambia is still among the high burden countries for HIV. And the challenges that we have faced, firstly, I would like to mention that over the past few years, our prevention programs slowed down. That is number one. Our prevention program slowed down in that more concentration was placed on treatment programs. And as a result, we have struggled with a lot of new infections. So one of the key things that I would like to highlight is that as Zambia, following the launch of the HIV Prevention Coalition in 2017, we have picked up the momentum to ensure that our prevention programs are activated and our prevention programs are yielding results. We have seen that we still have high numbers of HIV infections in our population. For example, in our last UNAIDS estimate for infections, we had close to 45,000 new infections among adults. So what are the challenges in HIV prevention? One of the key things is that resources towards prevention has significantly reduced to civil society organizations that are key in implementing programs on the ground. We've also seen that the limited resources have affected prevention programs. The other is that we have more concentrated on the biomedical interventions, leaving out the structural interventions, and that has proved to be a challenge. We've also seen that our belief systems in the use of commodities has affected also prevention. For example, Zambia is largely a religious country where belief systems are very strong, and we find that use of condoms, for example, is something that has not fully been accepted or utilized fully, though they are available. Then we also have issues of sustainability of programs. We have had a lot of prevention programs come on board, but we find that they are always in a project mode. And because they're in a project mode, they fail to continue after the project has failed. The other challenge of prevention is that the engagement of civil society has slowed down. And we believe the role of civil society is critical to prevention because they are on the ground. They know the reality. And this is part of the challenges that we have seen and have experienced. And of course, apart from limited resources, program sustainability, we also find that in prevention, in our setup, a lot of young people tend to start well, but along the way, consistency in applying the prevention interventions slows down. And that also has been a critical part of the challenges that we face. And stigma and discrimination continues to be top of the agenda as well. Stigma in that it is affecting people, don't want to come out to access, even just to access a condom, it becomes a serious challenge. Behaviors have changed very slowly in our country, and that has continued to affect prevention. So that is also part of the challenge. And of course, we continue to have myths and misconceptions about HIV, who gets it, and how it is transmitted. So that is partly what I could highlight for now. Thank you.
Thank you so much, Ellen, for really very kind of informative presentation, but I have to say also quite worrying in many ways. You know, as you were saying, you know, investments in prevention have been going down. You described very well the kind of challenges that you're facing, and that's why it has been so difficult to overcome HIV and also the related stigma and discrimination, and to put in practice, you know, safety measures that can really kind of prevent the further spread. So thank you very much for that, and obviously we'll also come back to you on that. I would go to you next, Alex. The German Ministry for Economic Cooperation and Development obviously is very much engaged in the global fight against HIV/AIDS. You are supporting many of the international organizations, both from the UN, the Global Fund, other organizations. You're represented on the boards of these organizations. You're following all these discussions, and Germany obviously is a very influential voice, given the fact that Germany is one of the biggest donors, you know, for development, for health, and also for HIV/AIDS. Can you tell us a little bit, you know, why has HIV/AIDS such important position in the policy and strategy of the German government and of the BMZ. And what are you observing, on the boards of these international organizations? How is HIV prevention represented there?
Thank you, Christoph, and greetings to everyone on this call. And thanks for the kind introduction, and also Binod's presentation, also Ellen Mubanga's presentation on the reality on the ground in Zambia. It's really good to hear those views. Yeah, maybe just to speak briefly on our approach. I mean, Christoph, as you said, we are engaged in various international organizations, but also bilaterally in country. HIV/AIDS, obviously, as part of the SDG agenda, with this ambitious goal of ending actually the 3 diseases of HIV/AIDS, TB, and malaria by 2030. And as we're hearing these numbers that you also just mentioned, this goal is ambitious and will be really hard to reach if we continue with the current trends. As you mentioned, even though sort of incidence rates are decreasing, and there are some successes especially in high prevalence areas in Southern Africa, and also mortality is decreasing, but also we see it's sort of stagnating. It's not really at the pace that we want to see it to really be able to come close to the 2030 goal. And similarly in other regions, it's even more alarming if you look at Central Asia, Eastern Europe, other regions where actually incidence rates are going up, and also key populations are particularly affected. And still, HIV/AIDS is one of the leading causes of death in terms of when we look at infectious diseases. So it's really a priority for us, for the German government, also internationally, to continue the fight. And as you mentioned, our eyes are on COVID, and this is a disease that affects the whole planet, but HIV/AIDS still is quite a challenge in many places around the world. So it's so there's a really broad response. I mean, obviously with WHO leading the coordinating role, and then UNAIDS as the global coordinating body for the global response. But within that, maybe just speaking from the BMZ, the Development Ministry perspective, I mean, so it's really a broad response. I mean, at the center, you have, in terms of also financing, you have the Global Fund to fight AIDS, tuberculosis, and malaria, one of the biggest funders of the HIV response. So I will speak to that a little bit more later. But then you have also, as you mentioned, HIV/AIDS, and particularly prevention is a really sort of has a lot of points of contact. And as Binod was showing in this presentation, it's behavioral, it's structural, it's biomedical. So really to sort of also address all of these challenges, I think it's the broad response is required. And so you see UNICEF is engaged on HIV/AIDS, on mother-to-child transmission. UNFPA is engaged on sexual reproductive health and rights, because that's obviously a key issue. Also, if you look at the key vulnerable population in Southern Africa, with really adolescent girls and young women really in the center and much more at risk in other population groups. So UNFPA playing a key role. But also UNDP in terms of sort of more looking at the policy framework, more governance reform, etc., also quite important. And then also with these UN organizations, obviously quite engaged on addressing human rights barriers and challenges. But having said this, I mean, the Global Fund really is at the center, because it's a well-established, effective organization that has really made a difference in the last 20 years as we celebrate actually the 20th anniversary of the Global Fund. And I think it's the Global Fund is also changing. I mean, you mentioned sort of it was mentioned the focus on the biomedical response, and I think maybe the Global Fund also was sort of is still quite focused on that, because it's also delivering results, obviously. But I think maybe also we can talk about that later a bit more. But we also see a shift, and in the Global Fund now, with the new strategy being discussed with stakeholders all over the world, with civil society, with communities, with affected populations. And there is really, I think, a shift towards looking more at prevention, since we see these stagnating numbers, but also at sort of looking at the human rights barriers that we're facing, looking at the key vulnerable populations. So there's really a shift, and but there's a lot more to do. Maybe let me stop here. I don't want to sort of go on for too long, but there's a lot more to say. So I'm looking forward to this conversation.
Thanks a lot, Alex. Very important comments. Obviously, I was pleased to hear your positive comments about the Global Fund, and reminding us that indeed Global Fund is celebrating now its 20-year anniversary, quite an important step in the fight against HIV/AIDS. So we'll come back, and I'm sure you will get some questions later on, maybe from the audience, about the kind of changes in the kind of strategic direction, which I think will be very important in this discussion. Coming to you, Peter Wiessner, you've been not only leading the Action Against AIDS network, for many years. I know you've been personally involved in HIV prevention for a very long time and have huge experience in that, both in Germany, but now also working with many other civil society organizations and international organizations. Could you give us a little bit of an insight, how German civil society is involved in these international processes and exchanges, and your view also on the importance of HIV prevention in all of this work?
Yeah, thank you. I'm the policy officer for AIDS Action Against AIDS. In terms of international involvement, and yes, you're right, I'm working in the HIV field for more than 30 years now, and for 6-7 years for Action Against AIDS. We are integrated in the international processes that are going on. So there are the C7 and the G20 meetings where we align with the global health working groups, where we established discussion fora together with Vendor AG Gesundheit, where we provide our input and what's important for us. We just basically returned from the UN high-level meeting on HIV in New York with a sort of weak declaration, but anyway, we sort of try to provide input as much as possible, and we are really grateful for the openness of our government to sort of listen to the civil society voices. So we were part of the German delegation. I personally attend the Global Fund board meeting as a community delegate within the German constituency, and I watch and participate the UNAIDS program coordinating board meetings with all the processes that are going on, and of course all relevant issues that are globally addressing HIV and the problems involved are addressed there. So we are member, Action Against AIDS is member of the EU Civil Society Forum on HIV, tuberculosis and viral hepatitis. This is a civil society forum where we provide input to the Commission in regard to the European Commission's endeavors to cover HIV and the other viral transmissions. So this is something we closely watch. So we are part of the Global Fund Advocates Network, and of course the Global Fund is our heartbeat, and I would sort of really fortified the key principles of the Global Fund and what we achieved. So when I, for example, compare the civil society engagement and the options and possibilities that we have with what is possible in Russia, then I really think, yeah, there are so many achievements that we have, and this doesn't fall from heaven. I mean, this is a structure that got established. And when Binod, you talked before that there's this split between in the prevention between the BZGA, those who do prevention for the general public, and those who do prevention for key populations like gay men, drug users, sex workers. I mean, this is really smart from the government to sort of acknowledge that and to appreciate the communities in itself and give them money and a structure to support them. And this is completely different to what many other countries are doing. Like Russia is just maybe the most cross example, that they are not supporting civil society. They downgrade them. They violate their rights. If I look at the general situation, there are like 76 countries that have and anti-LGBT laws globally. There are 103 countries globally that would have punitive laws targeting sex workers. There are 108 countries globally that would have punitive laws towards drug users. So how, and these are the key populations we are talking about in the HIV response. So how can you integrate those populations when the only answer you have as a government is to sort of establish punitive laws and not integrating their voices. So just the fact that you are listening, that you are supporting to civil society is an achievement in itself. In terms of prevention, yes, of course. I mean, we have treatment as prevention. This was mentioned before. But then we have about 1.7 new infections globally each year, and I think this is a catastrophe. This cannot go on like this. So we have to do something more here. There are 12 million people globally that do not know that they are HIV positive. So this relates to testing programs that needs to be strengthened and is established. And if I look at the figures in South Africa, when 4 out of 6 new infections are among young girls between 15 and 19, then definitely something is going wrong here. So we have to do something. When we look at Russia, that has 99% of all new infections among key populations with no programs for them. What Russians do is they do HIV tests, of course, but they test the general population. This is completely brainless to me. They test a pregnant woman in the course of the pregnancy 3 times. So this does not make any sense. And no programs for drug users, no programs for MSM, for gay men. This needs to be established by or outsourced by other stakeholders, which know with no understanding from the government. I mean, this is something that really needs to change. So maybe I stop here.
Thanks, Peter, for that perspective and reminding us also of the importance of the political context, particularly for HIV prevention and all the work you've been doing there with other civil society networks. I will now ask a second round of questions to our panelists, but I would already kind of encourage all our participants who, as I can realize, have a huge experience in this field as well, to kind of post your questions in the chat, so that after this next round with the panelists, I would really like to kind of post some of those questions to the panel. We'll summarize that and bring it to the discussion. Thanks, Marvin, for breaking the ice. I think you have the honor of having asked the first question. So be ready to post your questions. We will kind of collect them, and then after the next round, I will address those questions. But first, back to our panelist, Binod. One of the extremely important organizations, obviously, in the global fight against HIV/AIDS is UNAIDS. It was created, in 1996. To kind of spearhead the global response against the pandemic. You're representing also the German government on the board there. UNAIDS has a new strategy. Could you comment a little bit about the UNAIDS partnership and what makes this approach successful in the international level, but also maybe a little bit the importance of HIV prevention in the new UNAIDS strategy. And if you like, also, a couple of words, following the recent UN declaration, because these are always kind of big moments that UNAIDS is preparing for to kind of get the political attention of world leaders. Peter referred to that. So what's your kind of experience and insight there, working very closely with UNAIDS?
Yeah, thank you. And I'll try to keep it short. I mean, I think I hope everybody's familiar with UNAIDS. I think the advantage that UNAIDS has is that it coordinates the global HIV response. So it coordinates the 11 co-sponsors and also supports country in the implementation. So UNAIDS plays a crucial role. I think it's the first time we see that a health challenge has been addressed in this multilateral, multi-sectoral way. And that's a huge advantage of UNAIDS, including what Peter mentioned, the inclusive governing structure, which includes civil society and people affected and infected, which brings a lot of reality to these board meetings. And I think it's very important. It's the first time that this was created. And I think in that sense, UNAIDS is very successful. Now, in terms of prevention, I think what we've seen over the past 20 years, there was this very strong focus on treatment, which is obviously logical, but and it was also this aspect of treatment as prevention. And I think in that context, we've kind of neglected primary prevention, and we've neglected biomedical, behavioral aspects of prevention. So I think the new UNAIDS strategy has a very strong focus on combination prevention, combination HIV prevention, which was decided, by the board, and I think in view of the fact that we still have a lot of new infections, and I think this is the goal of the strategy is really to change that. So I think also what the new strategy, the investment case in the new strategy, calculates basically that the investments into prevention and treatment will almost be the same. They're around 33%. They used to be very different. Treatment used to be 42% and prevention at 26%. So in the new strategy until 2025, it's almost at par. And that is, I think, very important. The other question then is really how do we move forward in this prevention approach? And Ellen has already mentioned the Global Prevention Coalition, which is also supported by the German government in really supporting, I think it's now 28 countries in developing very solid prevention strategies, national prevention strategies. And I think, as Ellen said, it was founded in 2017, so it's barely 4 years. But I think we can see some successes, and I will post the link of the report of the Global Prevention Coalition into the chat, because there's some really interesting progress that have been made in most of these 28 countries in terms of prevention. So with that, I think I would give back to you.
Thanks a lot, Binod. And I will now divert a little bit from my script because you just mentioned the Global Prevention Coalition, which is a very important body and very important recommendations. And I believe we have actually a member of that among our participants. I saw Christine Stegling that you joined this online event, and I was wondering if you're still on, whether you could say a few words about that. I know you've been very, very active on promoting HIV prevention globally, but also for the organization where you are the executive director at Frontline AIDS. Would you be ready to make a few quick comments, particularly on the Prevention Coalition and how you see the opportunities to strengthen HIV prevention in the future? Chrissy, the floor is yours. Somebody has to unmute Christine.
No, I have. Sorry.
Hi,
somebody just did what I asked because we couldn't unmute ourselves. Thank you, Christoph, and thank you everybody for your contributions. I was just typing a question as you pulled me up. Yeah, I was going to say, so we are part of the Prevention Coalition. And I think what we experienced in the high-level meeting, as Peter has so eloquently pointed out, is that we really struggled to get people behind what we had even agreed to before, right? So we had a situation where previous acknowledgements about why prevention is important, why we need to address inequalities and key populations and those most marginalized. We saw a real pulling back from certain parts of the global community. And I think for me, this is what our next real issue is. And the Prevention Coalition is really trying to figure out, how do you get political engagement in those questions? Because yes, we know what to do. I was just typing, we know what to do. We know the technology part of it. We know the right interventions. And in many countries, we have political will, but often prevention is the first thing that falls off the agenda. Often it is not targeted at the right levels or to the right organizations or the right groups. So I think our next battle is with the Prevention Coalition and with other aligned partners to really see, how do we make this weakened. I agree with Peter, political declaration. How do we carry this into the future? And my question was going to be to the panel, and that's something we discuss a lot in the Prevention Coalition. Right now, it feels often very difficult to talk about HIV prevention when most of the countries where it really matters are really struggling with COVID. So you sound tone deaf if you go into those communities and talk about the importance of allocating the right budgets to HIV prevention when people are really dealing with very much life and death situations. And I think the question of prevention and disease prevention and infection prevention becomes a really complex one when there isn't enough healthy health structures that include communities, and where you have to make difficult political decisions about where you assign your budgets. And I think that's one of the questions that we keep asking ourselves as the Prevention Coalition. How do we continue to be meaningful in those conversations? And I was going to ask people here on the call to really reflect, having known how we have struggled with HIV prevention and to keeping prevention on the agenda for so long. This feels like a crossroad where that might even fall off further as people's attention goes to broader pandemic response, conversations. And so I was going to ask people, what do we learn from our response in the HIV response, and how do we carry that into the next phase and keep prevention high on the agenda, which feels quite an uphill battle at the moment?
Thanks, Chrissy. Absolutely right, and I will hand on those questions to the panelists. But thanks a lot for your insights and for all the work that you've been doing in the coalition and beyond on HIV prevention. So let me pass on that question also to our panelists, because I think that will be on many people's minds. Ellen, maybe you can tell us a little bit about that experience in Zambia. I was going to ask you about the importance of the involvement of civil society in your programs in Zambia, and maybe you can touch upon that as well. But also maybe now in the context of COVID, how has that changed the work that you are doing in Zambia, and what are the kind of mechanisms to cope with that situation? Over to you, Ellen.
Okay, thank you very much, Christoph. Indeed, COVID has changed the way we do our work and has impacted greatly on our response. And you know that our communities are really closely linked together, and to work on prevention has become a great challenge. The civil society continues to play a critical role, and civil society's involvement cannot be overemphasized. They are key because, one, we still need them to connect to the communities. And if we are going to make any relevant breakthrough in prevention, we need the communities involved. So the work needs to be in the community to ensure that the response to HIV is addressed at the community level. So the civil society still play a critical role in this. And then we also know that the civil society's role in ensuring that they bring to reality what is happening on the ground. Many times we who sit in offices imagine, but the civil society are found at the grassroots, and they're able to bring to reality what is happening. And therefore, if we are to see results, we need to connect with what is happening on the ground. The myths, the misconceptions, the lack of resources that are not trickling down to the community, all that needs to be highlighted by civil society. And of course, civil society are the eyes. They play a critical role in monitoring and evaluating the programs. Sometimes programs go into communities, but they don't have impact. And without the involvement of civil society, we may not be able to realize impact and results. We also see that the civil society are critical in advocacy because they bring out the voice and they are able to tell the program, the policymakers, the government, the donors, what exactly is needed and what needs to be changed. And now, especially because of in prevention, we are targeting those populations that have been left behind. And those populations that have been left behind, they need the touch of civil society to come out and to advocate on their behalf. Now, with COVID, it has been difficult because we can't meet, we can't bring people together. And for us in this part of the world, technology is not so much available to everybody. So that also has affected. In as much as we are able to use technology to reach out, we may not reach the many who will require that information or who require to be brought on board because of the levels of technology availability to the communities. So I think I can end there for now. Thank you.
Thanks so much, Ellen, for bringing to us really the kind of reality on the ground also in the context of COVID. And we all know how complicated that is, you know, for people all around the world in all countries, but I'm sure in countries like Zambia also in a particular way affecting your work on HIV. Sticking to that theme, going to you, Peter, I know that Aktionsbündnis gegen AIDS has done quite a bit of work, you know, on lessons learned from HIV in this COVID pandemic and so on, and how that is affecting the programs. Can you brief us a little bit about the work you've been doing there?
Yeah, we developed 4 discussion papers exactly on that topic, what lessons we can draw from coming from the HIV response related to COVID-19. And yeah, in a nutshell, I would say first, do no harm. So I'm working in the HIV field for 30 years now. I sort of watched closely how the panic that came up 40 years ago and how the topic HIV and AIDS was represented in media, how that whole atmosphere did lead to discriminative and punitive law and did create stigma and discrimination. And sometimes I have the feeling, you know, when I hear words like Wuhan virus or Kung Fu virus, I just quote the former President Trump, Chinese virus. When I hear that, then it really reminds me what we did do wrong in the HIV field. So we have to take this under consideration. And people living with HIV, people living with HIV, we still suffer under the stigma and discrimination. Just try to get to a dentist somewhere in a rural area in Germany and tell them that you're HIV positive. You will experience a very difficult situation where you might not find somebody who's going to treat you because people are filled up with fears and did even now not get the appropriate information. And when we still have 50 countries that would not allow people living with HIV and AIDS working within these countries. So about 30 countries that would still deport people living with HIV based on the HIV status. And these laws are now 40 years old. So I just wonder, what are we doing now here? You know, with almost all countries shut down, with no connection to them. I mean, we in Europe, we can travel, yes. We might even be able, fully vaccinated, able to travel to African countries. But citizens from Africa, they cannot come to Europe. So what are we doing here? How long will it take to revise these laws, these measures again? So we have to do it smart. And I think there are real problems here. But I don't want to put it in a too dark light. I think that there are also lessons that we can sort of draw, that there is this the focus on key populations. This is extremely important, and I think the same could apply to people with COVID-19. So where are the elderly? Where are the prisoners? Those who really suffered the most under the lockdown measures? Where are the drug users? Where are those who are doing outreach work on the streets? Of course, there are limitations. But then when we experienced that COVID-19 was used, for example, by the government of the Philippines to downgrade and to ridicule gay men and drug users, and just to use measures to downgrade key populations. This is completely wrong, and we know how to do it better. We know how to do it better, and we have to follow what we know. And the resource issue is a huge problem. It took 20 years that people in the global south had access to HIV treatment. How long will it take now that the majority of people will have access to vaccination? This is a global scandal, and I think we have to learn from the HIV history, and there are many, many, many lessons to draw.
Thanks a lot, Peter. Completely agree. Lots that can be learned from the HIV experience, both in terms of prevention, participation of communities, but also now the question of access. That was the critical question 20 years ago for the AIDS community, how to provide access to highly effective treatment. And nowadays, we are struggling with this critically important question of access, equal access to COVID vaccines. Coming to you, Alex, my first question was around the emphasis of the German government on partnerships and intersectoral cooperation, and how you can make sure in HIV/AIDS that it is integrated as a cross-cutting issue in many projects. And I know the BMZ and GIZ are very active on that. But also, if you want, feel free to kind of comment on the discussion we just had. The impact of COVID obviously on HIV/AIDS programs and many other programs in global health. So feel free to kind of make a few comments there as well, but maybe first on the question of partnerships and intersectoral cooperation.
Yeah, thanks, Christoph. No, I mean, I think it's sort of obviously from a overall perspective in the health sector. I mean, we're also looking at, as you just mentioned, so reaching the goal of universal health coverage of health systems that are inclusive, that allow for equitable access, and then also for the integration of HIV health services in that, so not to create silos. I mean, and I think that's sort of has to be the goal. And as I just mentioned, I mean, all of these organizations work well together, and partnership is a critical element, but also partnership, as was just mentioned, between community work at the community level and governments to achieve that change. I mean, as we've seen, the structural barriers, human rights barriers, it sort of has to be both sides. It has to be sort of communities and civil society have to have the space and empowered to make a difference, and governments have to be on board as well. Normally, I mean, we've seen, as Peter, you've also mentioned, I mean, with when you see the messages coming out of the high-level meeting on HIV/AIDS, it's really worrying to see that governments are so little, investing in reaching those key populations. Yeah, I mean, I think it's coming back to the Global Fund. I mean, as really one key organization, even though I actually forgot to mention, obviously, also we are engaged in the bilaterally through KfW and GIZ. Obviously, we have really good projects, including one in Zambia. But yeah, I think with the Global Fund, I mean, it's really the strength of the Global Fund is exactly that, this sort of partnership model of bringing together civil society, communities, affected populations, and governments to the table to make a difference. So we would hope that the Global Fund does even more of that, to even work better together with the UN agencies, even though, I mean, of course, we have the SDG 3 Global Action Plan for Healthy Lives and Wellbeing, which is really the key instrument, and also sort of helps us, I mean, Binod with the health ministry and us also come together, because these organizations go across government ministries. But yeah, so I think it's that partnership model that is really required to make a difference. And I've seen Christina was here, which is really good to see you again. We had a conversation recently, since we are partnering also with Frontline AIDS, I mean, for instance, on removing human rights barriers in countries. And it's really that partnership that can hopefully make a difference. Yeah, I think maybe just quickly on also the effect of COVID, because that was mentioned. I mean, obviously that is sort of not only affects the HIV response, even though, I mean, particularly there we have seen numbers of interruptions of programs, access to antiretroviral therapies going down, testing going down. So that's really a big challenge, and that's why it's really great that the German Parliament has made available additional funds for the Global Fund and other organizations to respond to COVID. Obviously, I'm not going into that in detail, but in terms of supporting health systems with testing, with treatment, with protective equipment, and that obviously then also benefits the HIV programs. But yeah, we need to really monitor that closely. I think it's still, I mean, we see numbers coming out by WHO, UNAIDS in terms of interruptions, but it's still not 100% clear how large that effect will be. But it's definitely something that we need to have an eye on. Yeah, maybe I stop there again.
Thanks a lot, Alex, for those insights, and also for mentioning the role of the German Parliament and the kind of supplementary budget that has been approved and implemented by the German government. Let me also say, as someone who's quite closely involved in the whole question of financing the global COVID response, that Germany has really given a very positive example here. You can always hope for more, and we know there are huge gaps still for COVAX and for the overall response. But the fact that the German Parliament and the German government, implemented a kind of additional budget, making them one of the biggest donors to ACT-A and COVAX, should also be recognized. So that's an important point. As indicated, I would now do a first round of questions from the participants, and I will always kind of try to direct that to one of our panelists, and starting with your question, Marvin, that is directed to Ellen. So I will ask you, Ellen, then to respond first on that. And Marvin was asking, the advent of discreetly used therapy options is often seen as a potential game changer in fighting HIV. Could their availability in Zambia contribute to effectively fighting HIV, or is there danger of negatively impacting prevention by making it even easier to make HIV invisible? Ellen, what's your view on using therapies, and how does it affect the prevention campaigns?
Okay, thank you. Therapy use. Well, to start with, we have programs that are targeting key populations, and our approach has been access to commodities, access to health services. And as a result of that, it could be a game changer, but we have not yet fully utilized that opportunity. That's what I would say. Thank you.
Mm-hmm. Thanks, Ellen. Thanks also for being concise. Then I have a question from Katrin, addressed to you again, Alex. Binod mentioned in his presentation the importance of comprehensive sexuality education for HIV prevention, and learning from the example of the Federal, Health Education Agency. The impression is that this important topic in German development cooperation is receiving less support recently. Is that kind of correct, or how does it take into account the linkages to sexual reproductive health rights and the vulnerabilities of young girls and women? So over to you, Alex.
Thanks. Yeah, I mean, this issue obviously was also at the center of the conversation in the high-level meeting, and it's a really contentious topic. But I can really safely say that sexual and reproductive health and rights, and also sexuality education, is really a cross-cutting priority for us, for the German government. You mentioned some programs that were not continued, but I think it's maybe one reason is also that, as you probably know, in the area of health and education, we're also sort of building on very strong multilateral actors and organizations. So in that space, we really trust on those multilateral organizations, and I think looking at them, I mean, it's really all of them are working in the field of comprehensive sexuality education. Maybe just mentioning, obviously, UNICEF, UNFPA are engaged in that field, but also, for instance, the Global Partnership for Education, where Germany has really stepped up their support. I mean, they also address the issue, and of course, this sort of primary basic education is really the key to also integrate that type of sexuality education. Also, the International Planned Parenthood Foundation, we support the global financing facility of the World Bank, and obviously also the Global Fund is funding work in that area. So, and Germany has really stepped up their support in the areas of education and health, and also the sort of interface. So I think it's it's really a cross-cutting priority for us.
Great, thanks, Alex. Then a question to you, Binod. I think it was from Elena. You presented a very good visual on HIV and STIs. Do the actors in viral hepatitis and TB response follow the same chart, or is it organized differently in Germany? Are there separate services? I think this question is about service integration, and would be interesting to know about the German experience here. And I would add, maybe one could look at that both from the kind of national perspective, but also, of course, from the international perspective. As we all know, there are close links between HIV and viral hepatitis, TB, and so on. Would you like to comment on that?
Sure, and thanks for the question. And I try to be very short, because what I've shown was the prevention aspect for these diseases, and the treatment or the services aspect is obviously is privately organized, is also government organized. So they're more or less integrated. I mean, if you go, you need to go to specific physicians for sexual diseases, but so TB may be addressed or not. But the prevention approach includes hepatitis and also TB. So the prevention messages address a broad range of sexually transmitted diseases, including or infections, including tuberculosis. But the services, which is a different aspect, which is also Germany being a federally organized country, lies with the states. So the service provision is in the states, but it's usually more or less integrated. That's the quick response to this question.
Thanks a lot, Binod. And then I will turn to a question from Stephanie that I could address to almost all of you. And that is the question of the relationship between, vertical programs on HIV and the support for health systems, also looking at the triple burden of disease, as you expressed, that infectious non-communicable diseases, reproductive mental health, social inequalities. This is obviously, a debate that we've had, for many years in the international organizations, in civil society, in many different fora. So maybe I start, I start with you, maybe Peter, because you've also been involved in many of these discussions, both kind of on the board of the Global Fund and others, the kind of, how to get the right balance between the disease-specific programs, the health system strengthening, and that obviously also has a particular importance these days with the kind of pressure on health systems due to COVID. But then I would also ask the question maybe to other panelists. First to you, Peter.
Thank you. I just wanted to add something, some thoughts to what Binod you just said, because I did prison work for 6 years here in the NGO in Munich. I'm currently in Munich having a training here. And what we see German-wide, prison health is organized at state level, and health for prisoners is very often excluded from the overall health services. So in terms of access to HIV prevention, to hepatitis C prevention and treatment, prisoners are included, which is a scandal, because given the fact that the amount of people living with HIV and hepatitis C and all these diseases is much higher. But now to your question, I think if you look at the Global Fund, for example, I mean, you could come up with the argument, okay, this is a vertical approach. It covers the 3 diseases, but if you look in detail, in depth, it's not true, because the Global Fund itself has invests a lot in health system strengthening, and I think we know that. I mean, only virtual approaches, this is not the solution. So we have to integrate, we have to cooperate at all levels. And the Global Fund is a very good example of an institution that is exactly doing that. I just read last week a report on cervix cancer. And I think this idea to have cervix cancer screening as one of the leading causes of death for young women in African countries, all over the world, but in particular in African countries, because there's no treatment, no screening available. So to integrate that is just extremely important, especially when cancer is one of the leading causes of HIV. So to integrate tuberculosis prevention and treatment, knowing that tuberculosis is the leading cause of people living with HIV, this only makes sense. I mean, there's no doubt that we have to invest in a health system, that they need to be strengthened. And from our experience with Ebola, we know that those countries who did invest, where the Global Fund invested in those countries in the health system structure, dealing with the new upcoming disease was just more successful. So it makes absolutely sense to go beyond the silos and to invest in health system and community system strengthening, not only health system, community system strengthening. Thank you.
Right. Thanks, Peter. And same question to you, Alex, because I know in BMZ you have also been addressing this question, disease programs, health system strengthening for many years. It's a very important policy question. The BMZ has also this year made an additional grant available to the Global Fund, not on AIDS, tuberculosis, malaria, but to kind of support the work that the Global Fund has been doing on the COVID response. What would be your response to Stephanie's question? How can we best integrate that, realizing the importance of the health systems? How can they be strengthened while kind of supporting organizations like the Global Fund and the disease-specific programs?
Yeah, I mean, this is really one of our other also cross-cutting priorities, I have to say. I mean, it's really the question of not only thinking vertically, but always having the key populations in mind, but the people in mind. And that's also why in the Global Fund we are, I think, successfully with other partners have promoted the concept of an integrated people-centered approach. So really to go and not kind of create those silos and fund separately programs against specific diseases, but really look at people, patients coming to receive health services, and then, as also Peter was mentioning, to look at what they face, what sort of threats or risks they face, and not just look at single diseases. And I think that's in the Global Fund, that's heard, I think, loud and clear, and I think it's quite well reflected now in how the Global Fund will go forward. But I think it's also in, let's say, Gavi, right, for immunization, which is also one entry point for parents to go with their children to the doctor to get vaccinated. It's also kind of a point of entry for a contact point, right? And also in Gavi, we're promoting health system strengthening, and I could go on with other organizations. So it's really, it's a key issue, but there is definitely also room for improvement, right? I mean, there's I mentioned the Global Action Plan on SDG 3, which also has a primary health care area of work, and we would like to see more progress made, that basically these international organizations sort of coordinate better and come up with the more common approaches, joint approaches to address this. But then obviously also it is on governments to establish systems that sort of allow for this. And yeah, so it's really yeah, it's key because it's all interconnected, and we see this now also with comorbidities. I mean, looking at HIV and TB, and it's really important to just look at the risk factors there. We stop there. Thanks.
Thanks a lot, Alex. I would be very interested, Ellen, to hear your point of view there to the same question. I mean, you've seen also a lot of kind of financial support for the AIDS programs in Zambia. You've probably also seen, you know, the effect of that on the health systems. How would you see the kind of benefits and challenges there, and maybe also looking at the effect on the health system before COVID and now in the COVID crisis? How does the kind of funding that also goes into HIV prevention and treatment support or distract from the COVID response?
Okay, thank you. Yeah, the COVID has definitely affected the health systems in Zambia. And the funding or resources have been diverted to strengthen the response towards COVID. And as a result, most programs have sort of slowed down. And also the fact that in health system strengthening, we are looking also at resources, human resource. And most of our health workers have been diverted now to focus on responding to COVID. And as a result, you find that attention has not been given. And in terms of, apart from even the information systems, in terms of capturing our information, everything about the systems have been affected because of COVID. Now, looking at HIV prevention and where we are coming from and where we are at the moment, if we do not deliberately or intentionally put in effort to strengthen the health system in terms of HIV prevention and treatment, we are likely, from Zambia perspective, to lose the gains that we have made so far. And that will affect the response. And especially that we are in a critical period going to 2025, 2030, and we seem not to have critical support directed, because a lot of support now in the system is going towards COVID, response to COVID. And that definitely is affecting the way we will respond to HIV prevention and treatment. So there is need to critically continue strengthening the systems, because it is important, or else the gains we have made will be lost if we do not strengthen. That's what I would say. And of course, the integration part is very critical, because as we are looking at the various types of health issues, we need to ensure that we bring all these that are connected, including the ones, I think it's Peter who talked about the cancers and everything, bring them together to be able to address, as we address HIV on the table. Thank you.
Thanks so much, Ellen. Really very insightful comments. I hope we've addressed a number of the questions from the participants, so that I would like to go now to the kind of final round, to our four panelists. And in this final round, really looking at the future. We've identified, you know, a number of challenges. We know what needs to happen to strengthen HIV prevention. We discussed some of the kind of reasons why this has not been the case, and in the recent years, the challenges of the COVID pandemic. But now, you know, what's the kind of conclusion, in a sense, from all of that? Where can we go from here? And I would like to start with you, Binod. From your perspective, you know, working with UNAIDS, having, you know, been part of this process leading to the declaration of the UN, also with the kind of very strong kind of, I would say, push for HIV prevention and highlighting, you know, why this is so necessary. What would you suggest, you know, what needs to happen that in the next 2 years we will really strengthen that? And I can see, you know, it's a challenging question, but I think that's the question that we all now have to address in this context. And obviously, you can speak from your perspective from the Ministry of Health, but also in your personal perspective. I know you've been doing a lot of work on that for many years in different capacities.
Yeah, thank you. And I think, Christoph, you already said, we know how to do this. We know the what and the how. And I think the challenge is, we know prevention, what works, how it works. We know how effectively implement this. The challenge is the barriers, the structural prevention measures that are not in place. And I think UNAIDS has a role to play in this. UNAIDS has 3 strategic areas, and one is addressing barriers. And I think UNAIDS has an important role to play. And we see, I think we've learned, and what we've seen in the international discussion is that more and more countries are not willing to buy into this approach, which is rights-based, which empowers communities, which works with communities and with people affected. They deny the term key population. They water down comprehensive sexuality education into something else. And the aspect of sexual reproductive health and rights is something that they refute. And I think it needs a lot of lobbying with these governments to make sure that these known and effective and efficient prevention methods, and also treatment methods, but prevention methods can be implemented. And I think UNAIDS as a global advocacy organization also has a role to play, as do we governments, where we discuss with our counterparts in these declarations and resolutions where we discuss these details. And I think it's very important that we work on this and that we work with these governments, because it's countries, there's always governments and there's civil society. We work with civil society. Germany works with civil society organizations. Even the Ministry of Health is working with civil society organizations in Eastern Europe to make sure that we slowly break down those barriers. And I think UNAIDS UNAIDS has a role to play there.
Thanks a lot, Binod. Alan, what ideas do you have, for the future of HIV prevention in Zambia? And if you had a wish to this group, that is in this event, from many different organizations, what would you expect, from this group? What can be done to support you to promote HIV prevention in Zambia?
Okay, thank you so much. Indeed, HIV prevention for Zambia particularly is still top on the agenda. And prevention for us, especially among the adolescents and young people, of course, with the key populations. For Zambia, in terms of key populations, we don't have so much information, and I think you will check even when you go to the HIV Prevention Coalition website. When you look at our poster, we do not have adequate information on key populations. So even our programming has been very much affected on that, though we have not sat. We are doing something, and I think this year Global Fund is supporting us to do some base surveys and to ensure that we have information. So prevention is still critical to us. And for me, my wish is that the German government should continue supporting Zambia to ensure that we strengthen our prevention programs, especially among adolescents and young people. They must continue to empower the local civil society organizations also to get involved in the programming, because as a country, we would like to see programs at scale. One of the other challenges I may not have highlighted is the scale of programs in country. You find that we have wonderful programs, but they are at low scale. And we would want partners such as the German government to continue supporting Zambia to strengthen the scaling up of programs. We have seen programs that have worked, such as the JIC that I think was highlighted in the first presentation. That is a wonderful program, but it is limited to a small area or a small parts or small districts in the country. We would like to see that program go to scale and supported, and ensure that it is integrated in the main system. So the future is to ensure that our programming is at scale, And our designs are involving the community, they are involving the populations that have been left behind, they are involving the key populations, the adolescents and young people, and ensure that we have increased access to the services and we have a strengthened and robust prevention program as a country. Thank you.
Thanks so much, Alan. Very clear, very comprehensive. Over to you, Alex, for the last question. We all know that for the BMZ, the framework for basically all you're doing are the Sustainable Development Goals, and also what we're discussing here as part of SDG 3 and the goal to end AIDS by 2030. From the current perspective, what do you think? What needs to be done that we are not losing sight of that goal? And maybe you would also be the right one to address the question that Marvin posted here in the chat that is a little bit provocative, but can we go too wide and too horizontal? Because I think that might also come to mind, within the kind of sustainable development goals, it's such a kind of huge range of activities, interventions that can be done. What can we do? What do we need to do to stay focused and to get closer to those goals?
Thanks. On the reaching the SDGs and reaching SDG 3, I think it's very much depends on the impact of COVID and also how sort of the global community reacts. So I think beyond sort of really kind of keeping on the fight that we were leading before, and as mentioned, we were not really on track before. So sort of really keeping that ambition high and the financing and the political will and sort of doing everything we can. I think COVID will have a big impact. And I'm thinking a bit about next year when we go into sort of the thinking globally around what do we learn from COVID-19 in terms of pandemic preparedness and response. And I think it's a good idea to not just think about COVID, but really also look at other infectious diseases because they are also epidemics, TB, malaria, but also HIV/AIDS. So to take them into the conversation and learn from this obviously really terrifying pandemic, but at the same time also it unleashed creativity and thinking and innovation, and sort of to apply that also to other infectious diseases. So that's sort of maybe my utopian vision that would happen in the next year. And then in terms of going too wide, I think it's obviously it's such a complex landscape, but I think we are trying to look at where we have the most impact on lives saved, but also think about the systemic, that makes it more complex and maybe a little bit less measurable, a bit more chaotic, but to think about the whole system of health, and it's way too complex to address it also with our international funding, right? It's about national efforts, but One Health, of course, it's sort of setting these highlights, right, of things that are important. One Health is an issue that is critical for preventing the next pandemic from happening, and it's a key issue, but it's again in itself quite complex. So we need to sort of, within the complexity, pick and choose, but still kind of have that complexity in mind. Maybe that's my good last words for me.
Absolutely, very good last words, Alex. Thank you for that. Peter, back to you. I think both of us have been involved in the HIV response for more than 30 years, I guess. So a lot has been achieved, but as we discussed today, a lot still needs to be done. And the question to you: how can we ensure that this the HIV response is sustainable also for the years to come? As it's an unfinished business. It's still kind of high importance, and what can be done to keep it on the agenda and to make the response sustainable?
Yeah, there's still 12 million people globally that don't have access to HIV treatment. I think this is the most important thing. There are 1.7 million that do get newly infected each year. Those people need treatment if they want to survive. So we have to know where our epidemics are. Everybody's talking now about COVID-19, of course, because this is the center of all discussions. But let's not forget the other diseases that are killing the global south, that are killing poor people that don't have the fortune to have access to treatment, to prevention. I think we have to cooperate. We have to do a better job here. HIV field is not a siloed approach. I think I tried to make it clear with the Global Fund and in terms of health system strengthening. I think this sort of wording like horizontal and vertical, I think this is wording from the 80s. We just have to forget that. We have to talk about people-centered, community-centered, and key population-centered approaches. And if we do that, all this sort of unhelpful wording is sort of unmasks as what it is, basically misleading. We have to know our epidemics, we have to know our key populations, and we have to know what people need that are sick. And this is basically the same for HIV, for cancer, for tuberculosis, for hepatitis, and so on, and so on, and so on. These are my last words. Thanks.
Very good. Thanks a lot, Peter. We are basically at the end of our session, and before I really close the session, I wondered whether we can give the microphone once more to Christine Stegling, because we have the benefit of having a global expert here really on this topic in our group. Chrissy, would you be ready just to very briefly make a final comment on where do we go from here on HIV prevention for the future?
Yeah, happy to. Thanks, Christoph. For me, it's really we need to turn the issue that we have right now into a real opportunity. We have seen in the last 18 months how fragile health systems are, how fragile communities are. And here is an opportunity to really have a serious conversation about communities as a central part of health system strengthening. We have lost that conversation a little bit. And I think this will be what we really need to do to really put HIV prevention on top of the agenda. I think the new framework around using inequalities as the starting point, many of you have spoken about key populations, about human rights. And I think an inequality framework that we have used with the UNAIDS strategy is an opportunity for that. There is an opportunity to think about, we've been talking with UNAIDS about political incubator, to talk about what are the political strategies that we need to put prevention on the agenda. And I think, again, there is an opportunity here. So if we are smart, I think we can make this into an opportunity. If we're not smart, I think we're going to really go backwards. So that's maybe my last words. Thank you.
Thanks a lot, Chrissy, for those last words. And it saves me to kind of make last words because I couldn't express that better. So for me, it remains to thank all of you for participating in this event. I thought it was a really, really important and hopefully also helpful discussion on one of the central topics that is easily forgotten. Thank you all for your interest, for your active participation. Thank you to the panelists really for, very, very insightful, articulate panelists. Thank you so much for your commitment to this event and for your contribution. Thanks to the team there for organizing all these great, discussions and providing the platform for many of us to engage. Thank you all and have a nice afternoon. Bye-bye.